टाइम से पहले डिलीवरी तक प्रीटर्म वजाइनल डिलीवरी की, everything like all these challenges increase with age. So we are concerned कि you're talking about females की 35 की age से पहले pregnancy का लो, does the age affect males as well? So yes, males पे भी effect आता है, more so after the age of 40-45. With advancing age in males, हमारी जो semen का volume है वो कम होता है, libido is decreased, sperm quality and quantity is reduced. Along with that, the DNA, जो main हमारा DNA है, the DNA fragmentation happens. So DNA fragmentation index would increase. As a result, जो DNA sperm हमारा लेके देने वाला है एक को to make a baby, उसमें मेजर फ्रेजाइल ब्रेक्स होते हैं. एज अ रिजल्ट एम्ब्रियो ठीक से नहीं बनता, मिसकैरेज रेट हाई हो जाती है, बेबी में जेनेटिक एबनॉर्मेलिटी के चांसेस हाई है. सो जो स्टडीज हुई हैं अलग अलग एंड इन रिसर्च हमें पता चला है कि if the father's age is advanced, say for instance 45 plus, even with treatments जो pregnancy rates कम होती हैं, higher chances of abortions बढ़ जाते हैं, and in fact autism and schizophrenia जैसे mental disorders के incidence भी high होते हैं with advanced father की age. So what are the challenges that we face after 35? Now, as a couple, if you feel, कि, okay, fine, we are going to plan our pregnancy after the age of 35, so you should be knowing कि you might take a longer time to conceive. Now, हो सकता है एक accidental pregnancy हुई हो हमें before and it would have been कि हमने plan किया या हमने एक month हमने कुछ नहीं protection रखा and we conceive. We keep that notion in our mind and say, okay, fine, after 35, I would like to have my baby at around 36 and हो जाएगा वैसे ही. I have a good fertility. But after the age of 35, there is a higher chance that you would take a longer time to conceive naturally. And once we are in that timeline, we've made a timeline for ourselves. We find this is what I'm going to do and plan my pregnancy. It brings with us a psychological and emotional stress if it does not happen on that time. Along with that, when you have an ultrasound, say for instance, you're getting yourself evaluated, there is a higher probability that beyond 35, say in your late 30s or early 40s, बाकी gynecological issues जो होते हैं, say for instance endometriosis, fibroids, adenomyosis, ovulation ठीक से नहीं हो पाना, and accompanied with that we have an aging male partner as well, the male factor infertility, ये सारे factors जो है वो increase हो जाते हैं, which bring a lot of stress along with it. So how does healthy lifestyle go with fertility? Now we say, okay, fine. Nowadays, most of the people we're focusing on healthy lifestyle, yet it is very difficult to maintain as well. So diet and exercise, does it help? Yes. We have been under constant stress. It can be a personal, professional. We have young couples in the early 20s coming to us and saying कि मैम हमें बहुत ज्यादा stress होता है. Now there is a role of antioxidants and balanced nutrition. Antioxidants in the form of coenzyme Q, omega-3, or natural sources of antioxidants like just seeds, chia seeds, flax seeds, pumpkin, sunflower seeds, and green tea. ये antioxidants help in maintaining a healthy lifestyle. आपके अंदर के nutrition को maintain करते हैं. जो हमारा stress और इन सब का negative damage होता है, that is countered by the antioxidants. Balanced nutrition is very important. Taking appropriate amounts of proteins. Now, why do we say balanced nutrition? Because there are many fad diets जो internet पे चलती हैं. Some people who say, "Ma'am, I've seen this influencer. I like the keto diet she's given. I like the vegan diet she's given," and blindly हम उसको follow करते हैं without taking care of your individual needs. As an individual, you might be needing. You're vegetarian, you need a B12. The other person who is a non-vegetarian might not need vitamin B12. So, depending upon your lifestyle, your eating preferences, you would be needing certain nutrients in your diet. So, hence the role of balanced nutrition. It is very important to maintain a healthy BMI. Now, healthy BMI would be what is your
What is
best
your best
as per your height. So, it is important that you maintain a healthy weight and a healthy BMI. For instance, a 54 kgs for a 5'2" may be okay. For a 5'11" might be underweight, and a 4'5" kg might be overweight. So, a healthy BMI ensures you have a smoother journey when you're trying to conceive, and even after that, when you are pregnant. Stress management, need of the hour, that we include yoga and meditation in our daily life to maintain and manage the stress that we are constantly subjected to. It can be your work stress, planning your pregnancy, daily life. Every second minute, we have some stress hitting us. How do we do this? The most underrated thing that we have is adequate sleep. Now, like we have a schedule where we would sleep late in the night, early morning, we have to hit our offices, ending up with 4 to 5 hours of sleep. A good sleep, there have been various studies, a good 7 to 8 hours of sleep would improve the quality of your eggs, your sperms. So, a good 7 to 8 hours of sleep during that time frame so that your circadian rhythm is maintained. Having constant night shifts would affect your circadian rhythm कि हमारा melatonin secrete होना जरूरी है, you need to have sunlight, you need to sleep before 12. So all this helps in maintaining a healthy lifestyle and improving your fertility. It is important that we try to reduce any alcohol, smoking, vaping, or recreational drugs to as minimum as possible. The environmental toxins are unavoidable, but we can still have a cut down by choosing what we are eating or we are drinking. A soft drink would put you through chemicals. So you have to decide your food accordingly कि हम क्या consume कर रहे हैं so that we are taking food in plastic containers that would leach its own chemicals. We are eating these street vendor ka food served on a newspaper where the ink would be another chemical. So these are the environmental toxins that we are constantly subjected to और हम उसको notice भी नहीं करते, which would have some impact on your lifestyle. Fertility is just an aspect to it. So your health is affected. In turn, your fertility is also affected. So how do we know that we would be having trouble conceiving? Like, can I judge it early? Can I diagnose myself, get myself diagnosed early? And अगर मुझे evaluation की जरूरत है, how do I proceed with it? So whether you are in your early 30s, अगर हम सोच रहे हैं कि हमें अपनी हमारी प्रेगनेंसी लेट करनी है बिकॉज ऑफ करियर कंसर्न, सोशल कंसर्न्स, और वी ऑलरेडी हैड एक बच्चा एंड वी आर प्लानिंग कि हमें सेकेंड बेबी लेट करना है, एंड वी नो दैट दैट वुड बी समवेयर अराउंड इन अ मिड 30s और लेट 30s. So it is very important we get an early assessment done. जैसे हम रूटीन हेल्थ चेकअप करते हैं, जैसे हम अपनी बाकी प्लानिंग करते हैं, फॉर इंस्टेंस करियर प्लानिंग, फाइनेंशियल प्लानिंग, इट इज इंपॉर्टेंट कि हम फर्टिलिटी प्लानिंग करें. Few simple blood tests and an ultrasound would guide us कि हमारा fertility potential कैसा है, how can we postpone it. Now if I have a lower fertility potential, my egg reserves are on the lower side, even when I'm 31, I know that at 36 जब मुझे pregnancy plan करनी होगी, I would be facing serious issues. I get an ultrasound done. I know I have a fibroid, so it would not come as a surprise to me जब मैं 36 पे pregnancy plan कर रही हूँ. It would be in my line of management कि अच्छा मुझे जब भी pregnancy plan करनी है, I would have to tackle this fibroid first, and then I have to plan my pregnancy. So fertility planning, it is best done if done in advance. If not, if you have just started planning a pregnancy and socha कि okay fine, let's go ahead with it is very important we get a preconceptional counseling. Preconceptional counseling इसलिए कि हम अगर start करते हैं and 6 months later we realize कि ओहो हमारा तो thyroid elevated है or we have कोई और hormonal imbalance. So then it's like these 6 months we could not actually properly try for pregnancy and it brought a lot of stress. So it is very important that we have a preconceptional evaluation with the help of blood test, couple checkup. It is very important a couple checkup. Just thinking कि हमें एक बार pregnancy हुई थी and second में हमें issue नहीं होगा does not work that way. Thinking everything is okay, we are otherwise healthy, it should not be impacting the husband, सिर्फ wife के ऊपर age का effect होगा, so that is also not true. Fertility is a couple thing and the evaluation whether it is preconceptional हम कर रहे हैं या to manage your fertility is always a couple evaluation. So what are the treatment options? When should you go? So अगर हम 35 के ऊपर है, it is important कि अगर हम 6 months तक ट्राई करने के बाद अगर हमें प्रेगनेंसी नहीं होती है, so we go ahead and meet a fertility specialist. And if somebody is somewhere around early 40s or late 30s, like 39, 40, 41, 42, you've settled and you know that you want to go ahead with pregnancy. So we know because at the age of 40, chances of natural conception is only 5% in a cycle. So it is best if you're near your 40s, you consult a fertility specialist immediately so that एक evaluation हो सके and आपको right guidance मिल सके how to go ahead with it. So different treatment modalities है हमारे पास, IUI, IVF, ICSI, and the concept that we knew earlier, हमें पता चला that we learned about is like there can be a risk of higher genetic mutations or genetic abnormalities in the embryo in advanced stage. So we can use reimplantation genetic testing to screen embryos which do not have that genetic abnormalities, and a healthy embryo can be placed inside, so that हमें बाद में ये नहीं हो कि एज रिलेटेड जेनेटिक malformations in the baby आ रहे हैं, या इंक्रीज रिस्क ऑफ डाउन सिंड्रोम हो रहा है, या एनी जेनेटिक एबनॉर्मेलिटी जो हम इनहेरिट कर सकते हैं इन द बेबी. Timeline of intervention is, if you are planning to postpone your pregnancy, get yourself evaluated, get to know कि okay, after the 35 age of 35, what are the challenges that you would be facing and what should be done. If you are 35, after a preconceptional evaluation, wait for 6 months. If you do not conceive, please meet a fertility specialist. If you are 39, 40, and you're thinking of pregnancy, consult a fertility specialist immediately. Now, there are certain myths about fertility जो हमने अभी discuss किया, something related to them only. People think, okay, fine, ठीक है, कोई नहीं, हमें बाद में करनी है pregnancy, IVF तो है ही है, हो जाएगी pregnancy. So IVF per se is not 100% successful. The success rate varies by age, other medical comorbidities, and other factors. Say, for instance, anybody younger than 35 would have a good success rate somewhere around 70 to 80%. Near 35 would be 70%, and it goes down to 40 to 50% after the age of 40. Healthy lifestyle would guarantee a fertility that is very good. That does not hold true. It does help, but it cannot reverse your biological age. You think you can actually, I am 40, but I've been constantly taking care of my health and yoga and everything, but the biological clock would still tick. At the age of 40, no matter how healthy we have, हमारी lifestyle, genetic factors आएंगे ही आएंगे. The quality of the eggs would be on the lower side. But it works the other way. If somebody who's in early 30s or late 20s but बहुत unhealthy lifestyle है, तो उसमें definitely वो fertility को hamper कर सकता है. People think fertility is only a female issue. 37 years की age में couple आता है हमारे पास. They think only the girl because of her age would have a concern fertility के लिए. But it is always a couple thing. Males would account for 30 to 40% of cases of infertility. So, as I always say, it is the male husband needs an evaluation when you are getting a fertility evaluation, whether it is a preconceptional or after an infertility issue. People think IVF is the only solution. If I go to a fertility specialist, सब IVF ही बोलते हैं, but we have a wide array of treatment options available. Simple hormone correction can actually give you a pregnancy. Ovulation induction, intrauterine insemination, or IVF. So, and one thing is we think stress causes infertility. Stress would impact your overall health. So we would say, कि, okay, fine, ठीक है. It is very common that we meet couples in the OPD. The lady would say कि मैम काम बहुत stressful था. I was working in a bank. वो बहुत stressful था. इसलिए हमें लग रहा है pregnancy नहीं हो रही है. So I've left my job and now I'm focusing only on fertility. So stress आपकी overall health को impact करता है, but underlying medical issue है that plays a larger role. So you can manage that, but we cannot totally attribute it to stress that it would be causing infertility. Another important thing is egg freezing, which is a preventive measures. So ideally done before the age of 35 years. If you are a working woman, if you are a working couple, you're not yet settled, and you know that जब because of all the social career whatever constraints की वजह से you would be eventually settling down somewhere around 37 or 38 की age में, and you get a fertility checkup done initially and you feel कि अब later on मुझे pregnancy करने में at the age of 37, at the age of 39 or even 40 plus में I would have a trouble. So you go ahead with egg freezing. So egg freezing can actually safeguard your reproductive potential. You can have your eggs frozen for as long as you want. You can use, I mean, it does not necessarily mean, see, it is a backup option. हम egg freeze करते हैं at the, say for instance at the age of 32 किया, 37 पे you go ahead and try naturally. Everything works well. You keep them reserved. You don't have to necessarily go ahead with IVF. But God forbid, if you need an IVF, you have healthier, younger, and genetically normal eggs available, your own eggs for your fertility, for your baby. Similarly, semen freezing is also an option. Certain medical conditions, कोई treatment हो रहा है या हमें पता है कोई medical constraint है जिसकी वजह से husband को later on problem हो सकती है, at times cancers या कुछ होते हैं, तो semen freeze करके we actually use it in the future. For instance, there's a couple, अगर couple है, husband overseas है, they get married at 33, husband would come back again 3 years later. The lady cannot have a pregnancy till 36 or 37 years of age. So they can actually do one thing is get embryos cryopreserved. She can have the semen frozen where she can get the embryos made even when the husband is not here. So when they plan to have a pregnancy, the eggs were still 33 years old or 34 years old. Semen हम तब से embryo बना के हमने रखा है, and she would have a higher success with pregnancy in IVF, even with her own eggs. During this entire thing, whenever हम advanced age में pregnancy कर रहे हैं, it has its own challenges, troubles while conceiving, troubles while carrying forward a pregnancy, and managing the pregnancy and the baby later on. So it is mental health is very, very important. It is very important that we have, अगर हमें कोई stress है, we do not neglect it. We go to counselors. Support groups होने चाहिए. Even your friends be like, I believe that we women should be there for each other. Instead of pointing out to things to people, we should be more supporting to each other for their journey of fertility. Everybody has a very different journey. Everybody would have a different road to pregnancy. It is important we provide the support. And if we do not have support nearby us, if we feel हमारे आसपास के लोग are not supportive, it is important we go to a support group where we can talk to like-minded people and see how things worked out for them, how like they can overcome the stress. At the same time, any meditation or mindfulness session can also help us cope up with this emotional and psychological stress. So the key takeaways would be early intervention is very necessary when you're planning pregnancy at an advanced stage. If you know you're going to plan it later, you can always have a pre-fertility evaluation. Go for fertility preservation if it is needed. It can be egg cryopreservation, embryo cryopreservation, semen preservation. If in case you're planning your pregnancy, go ahead with the preconceptional counseling so that any koi bhi hamara factor which needs correction that can be tackled earlier. If you are beyond 35, wait for 6 months. If it does not work out, please consult. If you're near 40, consult immediately as soon as you're planning for pregnancy. Lifestyle changes, medical support, healthy lifestyle can improve outcomes. It is not solely responsible for it, but having a healthy lifestyle does improve the outcome of any fertility treatment that you're taking. And next, very important thing is seeking the appropriate help rather than going to your local practitioner, a GP. It is very important you come to the right place and meet a fertility specialist if you're looking forward to fertility. So you can actually ask any questions if you have. I'm Dr. Purnima Mathur from Oasis Fertility, Vadodara. If you have any queries, you can reach out at the number that is given on the page and we can have any questions.
Ma'am, the questions are in the chat box. There are some questions. Kindly check in the chat box.
Okay, so just one sec. Okay, the first question that I can see is, are there specific fertility tests that I should consider at this age? So, Aisha, if there is a simple test like AMH, AMH हमें बताता है कि what are our egg reserve. So now, if our egg reserve, because of late we've been seeing कि in late 20s maybe women have lower egg reserve, maybe because of the exposure that we are having, and there is a fertility decline. A simple blood test like AMH will guide us कि what is our fertility potential apart from the other hormonal tests. अगर आप सिर्फ planning के लिए देख रहे हो AMH, if you are looking forward to pregnancy, there would be other hormonal tests included as well, like thyroid, prolactin, FSH, LH, as and when needed. I hope I've answered your question, Aisha. Next is sperm count 0 as well as not good quality sperm quality. So अगर हमारा sperm count 0 है, so we know that उसको हम technically हम कहते हैं कि एजोस्पर्मिया है. Now एजोस्पर्मिया में testis में से sperms नहीं मिल रहे हैं. So there can be various reasons for it. So अगर कभी कोई एजोस्पर्मिया से डायग्नोज होता है तो हमारा फर्स्ट स्टेप होता है कि हम फिजिकल एवेल्युएशन हो, अल्ट्रासाउंड हो, एंड देन हम हॉर्मोन्स देख सकें. Hormones will tell us what is the reason for zero sperm count. And then a genetic testing. After these हम बता सकते हैं कि whether or not हमारी testis में sperm बन रहे हैं कि नहीं बन रहे हैं, और अगर उसमें से sperms retrieve करने का potential है कि नहीं है. If we feel it is सिर्फ obstruction, different causes हैं. In certain cases, simple surgical aspiration of sperm से हम अगर नीडल से स्पर्म से निकालते हैं, उससे हमें आईवीएफ में प्रेगनेंसी इजीली हो जाती है. बट व्हाट इज द इंडिविजुअल केस वो हमें हार्मोनल एनालिसिस के बाद ही पता चल सकता है. सो इफ यू हैव जीरो स्पर्म काउंट, मीट अ फर्टिलिटी स्पेशलिस्ट, गेट एन अल्ट्रासाउंड डन, हार्मोन एनालिसिस कराओ. उन हार्मोन एनालिसिस के बाद इफ द ट्रीटिंग डॉक्टर फील्स कि हमारे टेस्टिस में स्पर्म बनने का पोटेंशियल है, सो इन दैट केस मेडिकेशन स्टार्ट होने के बाद वी कैन हैव अ टेस्ट, सर्जिकल स्पर्म निकाल के वी कैन हैव अ प्रेगनेंसी. कैन इट पॉसिबल बाय मेडिसिन टू बी नॉर्मल? मिस्टर चंपेश्वर, अगर आपकी एज 32 है, यू कैन एक्चुअली गेट इन टच उसमें विद द नंबर. वी कैन गाइड यू. आपके ब्लड टेस्ट एंड रिपोर्ट्स देख के वी सीन कि अगर हम मेडिसिन देते हैं एंड अगर ऑब्स्ट्रक्शन नहीं है, यू माइट बी एबल टू हैव स्पर्म्स. बट इट वुड बी वेरी पर्सनलाइज, जो हमें आपका सारा इन्वेस्टिगेशंस एंड scans and सब कुछ देख के पता चलेगा. So please reach out on our number so that I can guide you further about it. Does age affect the chances of having a baby with genetic? Definitely, Damini. That is a major concern. Agar your age is somewhere around 39, 40, with every passing year, your chances of having a baby with Down syndrome would increase. So three main Downs, Edwards, Pataus, these are the common syndrome जो हमारी age related होते हैं कि advanced age में these genetic abnormalities can be seen. So it is very much advisable if you are in that spectrum where there is advanced age. So it is good to get a pre-implantation genetic testing done because it can be very psychologically and physically, emotionally challenging. What are the dietary recommendations to improve the fertility in women? If the couple is old, do we freeze sperm too? Okay, the dietary recommendations to improve fertility is a healthy lifestyle. Now, healthy lifestyle would include, in the diet, we would include a more less of processed food, more of plant-based, fiber-rich diet, more of fruits, and antioxidant-rich diet. These would help
Hello.
us improve the fertility. Yes. Um,
Hello, ma'am.
Hello.
yes, please. Okay.
Hello.
Uh, yes, please. You're audible.
Yes, madam, audible. Actually, our family having a problem with the PXDN gene carrier, ma'am.
Okay. So,
So,
see, if you have a problem with the carrier gene status, we can
yes, ma'am.
actually, if we have your karyotype, which specific mutation we have in your family, with the help of pre-implantation genetic testing, we can actually detect that specific mutation in the embryo and go ahead with the pregnancy just from the embryo which does not have that mutation. So with the help of pre-implantation genetic testing, it is possible to select an embryo without the mutation so that you can actually stop the inheritance of this mutation from in your family from now onwards.
Okay. It's advising us to go for an IVF, ma'am.
Yes. See, IVF is the only way where we can select the embryo after having a genetic analysis. So if we are looking forward to any specific mutation, we do IVF, make the embryos, do a biopsy of that embryo, see which embryo has that mutation and which does not have that mutation. And the embryo which does not have that mutation, that is transferred into the wife's uterus. And we get a pregnancy and a baby which does not transmit that mutation downwards now.
Okay. Is it possible to get a healthy baby, ma'am?
Yes, definitely.
Okay. Okay. Sure, ma'am.
Okay.
We are,
Hello.
we are in follow-up, ma'am. So that's why I call.
Okay. You can note down the number that we showed at the end, and that will guide you. We can
Okay, ma'am.
give you more personalized consultation for that. I'll take up
Sorry,
these.
sorry to
Hello,
interrupt, ma'am. Actually, we have sent a number in the chat box for any appointment or any consultation. You can just call us. I will just share it again in the chat box. Everybody, please refer to that. Thank you. Thank you.
Thank you, Sandhya. Will a gynec be able to help in pregnancy planning, or we should go to a fertility specialist? In today's era, I would suggest for a GI issue, would you go to a simple physician or go to a gastroenterologist? So fertility is a little more advanced specialty, and it is strongly recommended that if you have a concern, please consult a fertility specialist. If you do not have access to a fertility specialist, in that case, a gynec would be the best option for you. Shruti wants to know, can we get pregnant after family planning operation? Yes, Shruti, we can actually go ahead and IVF would help in that. These days, we do not prefer getting a tubal recanalization done. जो family planning operation में we close the tube, we prefer not doing that because of the increased chances of ectopic pregnancy. IVF would be a safer and more successful option to be considered. The potential risk for pregnancy after 35 for Okay, Shruti has added one more question. Is you and your husband's age is 32 and we have one kid. At the age of 32, you fall in that spectrum where you have a good success rate, Shruti. I think we can, like you would have a very good success rate with IVF, considering it is only a family planning operation which is preventing you to go ahead with pregnancy. So it would be advisable that you go ahead and initial evaluation and then opt for IVF. The potential risk of pregnancy after 35 for you and baby, how Okay. See, you've mentioned a very broader term, Sonia, after 35. So I would assume that you must be somewhere in the mid 30s, 35, 36, 37. So risk of pregnancy, any pregnancy after the age of 35 comes with its own hazards that there would be a higher likelihood of you having blood pressure problems, or if you have a family history of higher risk for diabetes during pregnancy, baby growth retardation. But if you are, see, we tell these just not to discourage, like it is basically that you might need a little more monitoring than a pregnancy that happened in early 30s or late 20s. With a proper monitoring and a good supervision, we can actually counter all these risk factors and manage them to get a very healthy and successful baby. For the baby per se, 38, 39 would be the age where I would expect more of genetic malformations, not at 36, 37. Lower birth weight in the baby would be a concern after 35. IVF has been effective. IVF as compared to other treatment modalities beyond the age of 35, IVF gives a higher success rate and more than that, a shorter time to conception. If I spend 1 year, 2 years trying to get conceived, waiting for natural things to happen, in IVF in 2 or 3 months, we can get the desired result.
Hello, ma'am. Just wonder, am I audible?
Yes, please. Sonia, is that you?
No, I'm Shruti.
Yes, Shruti.
Yeah, already we have done all tests. Mine, everything is fine. Only one problem with me is my AMH is 1.5, and my husband's semen analysis also done. His count is 11 million,
Million per
and motility is 1%. Can we try naturally by losing weight, or what is the option we can choose? Because my age is also 26. My husband age is 30.
See, Shruti, your age is very much in your favor, but you have to keep in mind that your AMH does not go well with your age. 1.5 is something that I would expect near 34, 35. But as I say, it's a more of a couple thing. Your husband parameters, a count where it is 11 million per ml and 1% motility, it is less likely that you would conceive naturally. So your husband majorly requires an andrologist consultation, a detailed evaluation. What is the reason for that low motility? Like, does he have any addictions? Is there any medical comorbidity? Like, what is his weight? Is he overweight? Diabetes, blood pressure, any other thing that could affect the semen analysis, semen parameters? Because with 11 million and 1% motility, natural conception does not sound very likely. So we would need to evaluate him. And with 1% motility, it is difficult to go ahead with IUI also. I would suggest your husband needs a proper treatment. Now, best thing about males is unke nice, they make new sperms every 3 months. So if we find any hormonal factor or any other thing that needs correction, we correct it and then we reanalyze the semen and see if there are
Yeah.
any improvement or not.
So yeah, mine everything is fine, doctor. Like only AMH. I think my age is favor on my side. So I've done that FSH, prolactin, like everything is fine. So
See, with your husband's parameters, like with 11 million and 1% motility, in a natural pregnancy, the sperm would not be able to manage reaching the egg and give us a pregnancy.
yeah,
So
by
here you are more of a male factor infertility, where your husband needs treatment and evaluation, and then your line of treatment, like what should be the ideal mode of treatment, would be decided by your husband's semen analysis.
yeah, like using medicines after 3 months, there may be any change in motility.
Yes. That is why I say, instead of doing a blanket treatment, we at Oasis prefer that we have a detailed evaluation and we try to treat the specific cause which is giving us the trouble. So instead of just randomly eating things and medicines, we prefer we have a detailed evaluation. Because if you are 27, your husband must be somewhere in early 30s maximum, right?
Yeah.
So
And
like
we are thinking our age is small only, right, doctor? Like we
we've
don't.
Shruti, we've done IVF in people, couples as young as 20 to 23 for all various reasons. So just because you
Yeah.
think my age is on the low good side, I should wait before I get any intervention done. So in that case, by the time you decide to get an intervention, our AMH, which is already on the lower side for the age, would come down a little more and might pose us a challenge. Right now, the only major challenge is the semen analysis. And 3 years down the line, when you decide for going with the treatment, I'm nearing 30 now, I should, then another challenge would be low egg reserve as well. I would suggest, now that you've thought of pregnancy and we know that we are struggling on one aspect, right? Right now, it is the right time to
Yeah.
undergo treatment and go ahead with pregnancy.
Yeah. Yeah. Any
Uh,
suggestion? Like, sorry to ask, but
now, Ashwati, let's do one thing is that my number would be shared and then we can have a call consult and we can talk in person
Mhm.
so that we can
Yeah.
just wrap up everybody's question answers also, right?
Yeah. Thank you. Yeah. Thank you so much.
You're welcome, Shruti. Sonia, there are certain vaccinations. One of the most important one is the rubella vaccination and the routine health screening that is done before the pregnancy. So, yes, and if you are young, you've not had your HPV vaccination, it is also recommended that you get it done. So, yes, health screening is needed before pregnancy. And Dr. Pallavi, we do suggest lifestyle changes, as we've mentioned. Yoga helps, eating a good balanced diet, exercising regularly, because most of the times now, when we come across couples, rarely do couples come and say, ma'am, we have an active lifestyle. They would say, ma'am, we're so exhausted and so stressed by our work that we rarely get time to go out and exercise or do any physical activity. It is very important that we have some physical activity, at least 30 minutes of active workout 5 days a week. That helps. Eating a balanced diet helps, including fruits, vegetables, and antioxidants in the diet also helps. And the most important thing, maintaining a circadian rhythm with an adequate sleep. That would help us with the fertility. I think we have a lot of questions. I'll just rush through them. Adenomyosis of 4 centimeters in low AMH treatment. Should I go for adenomyomectomy or Leupride is enough?
Yes,
First
ma'am.
egg retrieval.
Having adenomyosis, ma'am.
And first egg, okay, Anilatha, right? Am I?
Yes, ma'am.
So you've had an IVF, you've had an egg
Yeah, in
retrieval.
2020, I had an IVF, ma'am. It's failed.
Okay. And you see, uterine artery embolism is not for you right now because you're looking for pregnancy.
Okay.
Your AMH is how much, dear?
0.7, ma'am. In 2020 only.
And do you have any embryos cryopreserved?
No, 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 ma'am. Planning for
So,
second IVF.
okay. So Anilatha, first thing should be because our AMH is on the lower side and your age would be how much?
33.
33. So the age is in your favor, but the egg reserves are on the lower side. So it
Yes,
is
ma'am.
important that first we preserve our embryos. The embryos should be
Okay.
cryopreserved so that by the time we manage the adenomyosis, the egg reserves do not deteriorate further. And once you
Okay.
have a good number of embryos cryopreserved, because we know in adenomyosis the uterus gets bulky, the
Yeah.
implantation rate would reduce. So
Yeah.
in that case, depending upon what your 3D ultrasound says, where exactly is your adenomyoma? Is
It
it
is
in the
globular, ma'am.
implantation? It is where in the upper part or the lower part. You can share the image with me later on. So
Okay,
depending on
ma'am.
that, we usually prefer if somebody has severe adenomyosis, which
It is
cannot,
10 centimeters, madam. Uterus is 10 centimeters.
the uterus is bulky. I must say it is
Yeah.
bulky. So in
Yeah.
those cases, we do have a Mirena insertion for 3 months, and then we go ahead with transfer if we are satisfied with the blood flow and everything. There are various factors also where because you had your IVF in 2020 and it is 4 years later that you're telling me that right now
Yeah.
where uterus is this. So 4 years earlier, your adenomyosis would have been on a lesser volume as well.
Yes, ma'am. Yes, ma'am.
So if that IVF did not work, there would be other factors as well which need consideration. What was the quality of the embryo, or how was the endometrium, the blood flow, receptivity, any of the other factor. So
Okay.
we'll have to go through that. We cannot solely attribute that it was only adenomyosis that it did not work. We'll have to go
Okay.
through everything, because when you're going ahead with the second time, we have to be very sure that we've left no stone unturned, right?
Yeah.
We have to look into everything. Okay, how was my embryo? How was my uterus? How was my blood flow? Was my receptivity okay? Any other medication that I need after my transfer? And then plan your next transfer. So first is getting the embryos cryopreserved because the egg reserves are low, and then you can calmly manage your adenomyosis, and after checking everything, go ahead with the transfer.
About the
Okay.
adenomyoectomy, ma'am? What?
Adenomyoectomy would depend upon how does your ultrasound look like.
Okay.
So it is, if somebody has a diffuse adenomyosis, it does not need adenomyoectomy. Somebody has a localized adenomyoma, that
Yeah,
is where we go
localized,
ahead with.
ma'am.
So depending on what, but adenomyoectomy should be done after you had your embryos cryopreserved.
Everything. Okay.
Okay. Okay, Anilata?
And any pre-treatment, ma'am, before IVF for more embryos, more eggs?
We have two schools of thoughts. Some believe in ovarian rejuvenation, which we
Yeah.
do routinely at Oasis. We go ahead with ovarian PRP,
Yeah.
and that is, some studies say it is effective, somebody say it is not effective. I've been doing it for a couple of patients of mine, and they've shown a good response.
Yeah.
And we can go ahead with ovarian rejuvenation and embryo banking. We say if I have a low reserve in one cycle, I get 2, 3 embryos. We go ahead in second cycle, we pool the embryos. Once I know I have good number of embryos preserved, then I go ahead with transfer.
Okay.
So that keeps you
Testosterone
very
gel, ma'am?
much relaxed. Sorry?
Testosterone gel. Testosterone gel.
Testosterone androtas gel, yes, it also works.
Okay.
But they're not taken for longer time. See,
Leupride
these are all
acetate 50
adjuvants.
ml daily before IVF, ma'am.
Yeah, see, it is the adjuvants would be DHEAS, Androtas, the testosterone
Yeah.
gel, hoping that it would improve. But
Yeah.
as the major consensus, most of the fertility specialists agree. The only thing is, how soon can we get it done? Because the number of eggs would be declining with age only. So
Yes.
we cannot say if I need treatment low and then wait for a month before we do this. It's like, let's do it quick. Let's not
Yes.
waste the eggs that we already have,
Okay.
right?
Okay.
And Farhad says, okay. Farhad, your age is 38 and AMH is 0.35. You're planning for a second baby. And this would need a detailed evaluation, because we know at this age, with that reserve, the age, we want to know the husband parameters also. The chances of conception get a little lower. So at 38, if you're looking forward to pregnancy, you should actually in person meet a fertility specialist as soon as possible. Because with an ultrasound and everything, you would get a very personalized guidance regarding how to proceed further with the fertility planning. Is that okay? Chetna says her age is 35. अच्छा है, रिलेशन ट्री का एजेक्शन भी दिया, हस्बैंड का स्पर्म भी अच्छा है. ओके, चेतना, 35 ईयर्स की एज है आपकी. अभी आप 2 मंथ से फॉलिकुलर स्कैन कर रहे हो. अगर आप, आई एज्यूम 1-2 साल आपने पहले नेचुरली ट्राई किया होगा एक बनने की दवाई लेने से पहले. बट हमें अगर अभी भी प्रेगनेंसी नहीं हो रही है, क्या आपने ट्यूब की टेस्टिंग कराई? आपके हॉर्मोन्स कैसे हैं? और अगर आपके एग्स हमेशा रूटीनली प्रॉपर बनते हैं, साइकिल्स रेगुलर है, हस्बैंड पैरामीटर्स अच्छे हैं, तो आप उस अनएक्सप्लेन फर्टिलिटी के ग्रुप में आते हो. उसमें हमारी जो लेटेस्ट गाइडलाइंस है, दे से कि इट इज बेस्ट इज कि हम आईयूआई करें. बट एक बार आप मुझे एक बार बताओगे कि अगर ट्यूब टेस्टिंग हुई है कि नहीं हुई है, आपने मेडिसिन कौन सी ली है, उसके बाद हम आपको प्रॉपरली गाइड कर पाएंगे. संतोष, इफ यू हैव फ्रोजन एम्ब्रियोज, यस डेफिनेटली, अगर डिफरेंट आईवीएफ सेंटर में आपके फ्रोजन एम्ब्रियोज है, यू कैन कंसल्ट आपके जो भी नियरेस्ट ओएसिस है, यू कैन कम वहाँ पे, गेट अ कंसल्टेशन डन. एंड वंस यू डिसाइडेड कि मुझे आईवीएफ एंड एम्ब्रियो ट्रांसफर अपना करवाना है एंड एवरीथिंग, तो थ्रू दी नेशनल एआरटी रजिस्ट्री जो है, वहां पे उनको मेल करते हो, एआरटी सपोर्ट है गवर्नमेंट का, कि आई वांट टू गो अहेड विथ माय एम्ब्रियो ट्रांसफर एट दिस इंस्टीट्यूट, और मेरे एम्ब्रियोज यहाँ पर है. दे गिव द परमिशन एंड वी कैन एक्चुअली अरेंज फॉर द पिकअप ऑफ एम्ब्रियोज, कि हम उस सेंटर से ओएसएस में शिफ्ट करके आपको ट्रांसफर में हेल्प कर सके. So you contact the nearest Oasis जो आपके पास है, come over, meet us, and after your evaluation हम आपको इसमें जो paperwork है, legal paperwork, because we believe everything on paper ethically and legally should be absolutely okay. So
Okay.
जब आप हमें government permission देती है, and then we can ship the embryos, and it is very easy. It needs only
Easy.
1 or 2 maids.
Yeah, ma'am.
Yes, Santosh?
Thanks, ma'am. Actually, I was worried on that because I don't have a trust on this organization where actually we
Okay.
have placed our embryos. They have cheated us.
I'm so
Right now,
sorry to
actually, we
hear
are
that.
having 10 to 12 embryos are ready with us, very good quality embryos.
Okay.
So I was planning to go with a different organization, trusted organization. I found that Oasis is doing best.
Yes, Santosh, thank you. So, Santosh, in that case, we have a national ART website. I
Is
would
Bangalore,
ask,
ma'am?
so,
Actually, I belongs from Bangalore. Where I need to contact?
I'll do one thing. I have my staff here. They will
Hmm.
reach out to you, and
Yeah.
you see the number. We'll reach out to you. We'll guide you where is the nearest center, and then
Okay.
there we can have a consultation, and we'll guide you with the paperwork also, where exactly you have to mail and what are the papers that we need.
It will be helpful for me.
Yeah, Santosh, we'll do that. Sure, you can put your number here so that we can reach out to you personally, or your mail ID, whatever you feel is convenient to you.
Yeah,
Hi,
chat. I go post my
hi,
number itself.
Soundarya, please look into it.
yeah. Hi, Santosh. Kindly share your number personally to me in the chat box. I will look
Okay.
into your concerns. Thank you. Thank you for
Thanks.
reaching out.
Thanks.
Okay, we still have a lot of numbers. Soundarya, do we have the time?
Yes, ma'am, we have 15 more minutes. So, yeah.
Again, okay.
Yeah.
So, okay. So, Sheetal is asking, in the age of 38, is it okay that IVF will fail for 2 times and it will succeed at the third time? Okay. Sheetal is like when we say that our IVF has failed for 2 times, we see if you are not looking, we say that we have to find out the reason that it failed. What were the factors that affected it? Like, what were the challenges in your previous 2 IVF? That were they addressed properly or not? Only when we look into it, we would be sure that it can succeed third time. Definitely, we've seen third, fourth, fifth, sixth IVF. It is your will and your determination, and the factor that how is your doctor guiding you and how is your treatment being managed. So yes, you can be very optimistic that your IVF is going to succeed the third time. We need to look into how were the embryos? When was it transferred? How was your uterus? Was there any difficulty during the transfer? Any other medication that needs to be added before or after the transfer that might help us in getting a successful result this time? So you can actually share the previous records and then we can discuss it in persons or on phone where I can give you a more personalized opinion about what needs to be corrected or what intervention needs to be done before you plan the third time. Mm. Debashri is saying she had an ectopic pregnancy, right tube removed, and she has endometriosis vertebrally done, but still unable to conceive naturally. Okay, Debashri, I'm so sorry to hear you had an ectopic pregnancy. I understand it can be very painful physically and emotionally. So endometriosis itself is a very big challenge that we face, the patient as well. It is very painful. I can understand like it would be difficult for you. So even endometriosis, definitely it impacts the IVF success rate because the endometriosis per se would affect the quality of the egg, in turn quality of the embryo, the inflammation that is there in the body because of the endometriosis. Because now you had an ectopic pregnancy, that means our right tube had some pathology. Because of that, we had an ectopic pregnancy. And if it is most likely because of endometriosis, there's a difference. We would be saying कि हमारी tube खुली है. There's a tubal patency done. But there are other factors also, Devishi, that play a role. Like how are the cells inside the tube, the interior of the cell, the tubes, which would help in the movement of the embryo, sperm, egg. Now, if that is impaired, we have an ectopic pregnancy. So when we have one ectopic pregnancy, there's a higher chances that the other tube might not be as healthy as it appears to be. So with endometriosis, having had an ectopic pregnancy, the chances of conceiving naturally would be on the lower side. If your endometriosis, because you conceived you had an ectopic, I think your endometriosis must not be severe. For endometriosis, we believe the sooner you have a pregnancy, the better it is, because with as the time would lapse, the endometriosis would become more and more severe, making it more and more difficult for us to conceive. So it is how as soon as possible get an IUI. If it is not working, not conceiving naturally, please opt for IVF earlier. IVF would give us a success rate. It depends upon what your age. Devashri, I don't know your age. I don't know the extent of endometriosis. So giving a success rate for somebody with endometriosis in IVF would vary. Somebody who has a simple endometrioma, mild endometriosis to extensive endometriosis, all of them would have a different success rate. So, saying कि endometriosis does have an impact, somebody who has a chota sa endometrioma would have the same success rate. Mild endometriosis gives a good success rate with IVF. Severe endometriosis would have its own challenge, would be a little time consuming also. But then there are other things that needs to be taken. कि, okay, fine, once we have a good embryo, we see if there's any endometriosis that needs removal, endometriomas inside, endometriotic deposits that need correction, have leukoid, and then go ahead with a transfer.
Hi, ma'am. Debashri this side.
Yes,
So,
Devashri.
so my age is 28, ma'am. And recently I have gone through the endometriosis removal and the tubal patency for the left side. So after
Okay.
that, the doctor mentioned to try for at least 6 months whenever it's ovulating from the left side. So all those natural, we tried for naturally for 2 cycles, but it didn't work. So now doctor mentioned to like go for IVF. So
See, Devashri, ideally, at times we think that everybody we have a lower threshold for IVF, but we know you had an endometrioma surgery, the endometriotic deposits were cleared. Right now, your body would be in best of its health. So this would be the right time. We say try naturally. It does not happen in a couple of months. Please go ahead with IVF. That would ensure you have a pregnancy before you have another recurrence of endometriosis. Now you say, for instance, you decide, "Nee, I want to wait a little more natural," and ये सब हम 6-7 months wait करते हैं. 7 months में there's another endometrioma developing, and then we say, Devashri, before even we go for IVF, let's have another surgery. Having gone through a surgery once, you know that it is physically challenging. It is not that it's as simple. So my
yes,
advice would also be that only ki, please, you're young. Most likely your quality should be absolutely good. Endometriosis should not have hampered it that much. So you would get a very good result with IVF and at a very shorter time duration as well. So my advice would also be go ahead with IVF if you've tried for 2 or 3 cycles. So IVF would work for you best. Don't give
so
it
ma'am,
second thought.
in Bhubaneswar, I'm from Bhubaneswar actually. So how can we
Yes.
contact?
So Debashri, I'll ask Saundarya to get in touch with you as well.
Yes.
And Saundarya, you can guide Debashri for that.
Yes, ma'am. Devashri, kindly share your number. We have our branches in Bhubaneswar as well. So I will send you the location and our customer team will get back to you.
Okay. Okay, ma'am.
Thank you. Kindly share your number in the chat box personally.
Thank you, ma'am.
I think we've answered all the questions, Saundarya. I think we've
Yes, ma'am.
answered all the questions. If you have any queries, there's a number dropped in the chat box. You can drop a message on that. My team would get in touch and you can get in touch with me. We'll try to solve as much as we can and guide you how best we can help you out. Thank you so much for your patient listening. Anilata, you want to speak something? You can say, you raise your hand.
No. I spoke now.
Okay, yeah, sure. Thank you so much.
Okay.
Thank you so much for your patient listening. Please, if you have any queries, there's a number dropped in the chat box. Contact on that. We would love to help you out with your problems.
Thank you so much for the session, ma'am. I think a lot of people got help because of
I'm
you.
glad. I'm glad to help.
And yeah, and request everyone to contact us for further questions. The number is in the chat box. It's 79929 79929. And yeah, we will get back to you.
Thank
Thank
you
you.
so much. Good evening. Have a good day, everybody.
Thank you, ma'am. Good evening, everyone, and bye bye.